Hello everyone and good evening. As I mentioned before, and I'm very in a hard situation right now because of upper respiratory tract infection. Apologize me for my bad voice, please. In the autism spectrum disorder, we know there are certain morphometrical changes, and I will try to elaborate on it before I will make some definitions and then try to give some interesting examples from the literature to shed a light on this topic. In our clinic, we have many cases, and through those cases there is an ongoing master degree thesis, and in our clinic, thanks to this master's degree program, morphometrical methodology has been developed, and I'll try to mention it as well. As you all know, autism spectrum disorder is a biologically based neurodevelopmental disorder characterized by impairments in two major domains: deficits in social communication and restricted repetitive patterns of behaviors and interests. When I talk about morphometrics, it is a field of interest on the differences and changes in the structure of organisms and objects, and morphometrics convert these differences into numerical values with using mathematical techniques. So generally, in the autism spectrum disorders, the pathogenesis of autism spectrum disorder is incompletely understood, but the general consensus is that ASD has a genetic etiology which alters brain development, affecting social and communication development and leading to restricted interests and repetitive behavior. Supporting this is the epigenetic theory, in which an abnormal gene is turned on early in the fetal development and affects the expression of other genes that are not mutated themselves. Neurobiologic factors, especially neuroimaging and autopsy studies in patients with autism spectrum disorder, suggest that brain abnormalities play an important role. Without a doubt, autopsy studies give very important study results, and on microscopic level there are many differences that have been detected thanks to autopsy studies. And these abnormalities include diffuse differences in total and regional gray and white matter volumes. All sulcal and gyral anatomy, brain chemical concentrations, neural networks, cortical structure and organization, brain lateralization and cognitive processing compared with individuals without ASD. We can see big differences on ASD diagnosed children. I have taken this information from UpToDate, so it is also updated information, so these are my references. During infancy, brain size increases, as we know. It is perhaps related to an increased number of neurons in the prefrontal cortex. Functional MRI studies, positron emission tomography studies have shown that children with autism spectrum disorder have global and functional abnormalities in serotonin synthesis. It supports that there are certain abnormalities on the brain. Neuropathological studies are very important, especially on cerebellum. There's decrease on the number, and frontal and cortical temporal cortex, there are some abnormal structure developments. The cortical abnormalities appear to result from dysregulation to cortical layer formation and layer specific neuronal differentiation during perinatal development. Progenitor cells migrate And this dysregulation shows us that there is a similarity with schizophrenia. Macrocephalia is one of the very important findings. Morphometrical measurements of it is very important for us because majority of these children have had circumference greater than 97th percentile. An increased rate of head growth is found in up to 70% of children, but they are not always diagnosed with microcephalia. Accelerated head growth, in terms of diagnostic interpretation, is crucial. Yes, okay, it is clinical observation, but this is not a must to put a diagnosis. Brain growth is mainly seen on the frontal and middle cortex. Head circumstances are normal at the time of birth in ASD. MRI findings vary with age. Brain growth is found at early ages then stops. Cerebellum and corpus callus are also reported to have a role in autism. There is a study done by Eric Corse and Karen Pierce. It is about brain overgrowth in autism during a critical time in development, implications for frontal pyramidal neuron and interneural development and connectivity. So they are talking about an increase on that parts of the brain. As you can see on the slide, on the neonatal period, pyramidal cell number increases with age, and also synaptic connection of these neurons, these cells, increase with age. Here you can see children between 2 to 4 year old. The gray matter volume is measured on the temporal and frontal lobe, especially between 2 to 4 years of age. Volume is higher. On the white matter, especially frontal and parietal region, here and there, you can see there is significantly higher volume on the autistic children. You can see autistic children between 2 to 4 years. On the panel A, medial frontal cortex, dorsolateral and medial cortex have significant growth, but on the panel B you can see that growth stops and turns into normal pace within time. Autism spectrum disorder is accompanied by some other situations, some conditions accompany ASD, and morphometrical changes occur at these conditions. One of them is tuberosclerosis. There are some tuberotomes, as you can see, towards the inner sides of the ventricle. Tuberomes grow. From post-mortem study findings, mini-colons have been found to be different on the ASD. Mini-colons have a stereotypical morphometry and are distributed throughout the cortex. They share common input-output operations mediated by recurrent circuits. Here you can see these are mini-colons structures from the cell core to another cell core. There is a straight line, and that structure is described as a mini-colon. It is like an architectural structure. In their organization and alignment, we can see some architectural studies. Casanova proved that in the morphometrical studies. He is a very important name, and we can see on this structure on A you can see normal control patient cortical section, and on the right ASD diagnosed children brain tissue, and there is a significant difference between these two. And the most obvious one is that there is an increasing number of the cell number. On the B column, many columns can be seen. There are like some lines from one cell core to another cell core. You can see this is a healthy child brain, but on the ASD diagnosed kid, number of the mini columns increases, and there are peripheral and neurophil shifts. Because of that, this number increases. This is what they foresee for this situation. Morphometric measures can be taken in different methodologies, but I will be talking about structural imaging. Why brain imaging is needed in ASD? Head circumference is very important. That's why brain imaging is needed. On the neuron number, there's an increase, and it can be related to the increased number of these neurons, or the average increase on the glial cells can create a problem. There are 3 types of cells apart from neurons: oligodendrocytes, astrocytes. Astrocytes regulate the chemical environment of neurons. If astrocytes are said to be responsible of the increase on the cerebral volume, then they must be taken into consideration in the treatment. Microglia cell located throughout the frontal cortex. Here you can see this publication was finalized in 2015 by Young et al. They made cortical morphometrical measurements, and they checked cortical thickness, surface area, cortical volume, and cortical gyrification. Generally, these measurements were done in mathematical techniques, but this is done with a free software, and you can download that software from the site, or methodology from that website. Comparison of global brain anatomy in children with typical developing and autism spectrum disorder. When we look at morphometrical cortical differences, thickness, volume, gyrifications, when we look at these rates, in many groups, in many areas, there is a significant difference compared to other children groups. Cortical thickness is very important. Brain volume and gray matter amount can differ as well. Here, gyrification with the autistic children is found to be higher. Gyrification is increasing with age in autism spectrum disorder, and there is a change based on the index. High number of the index shows higher gyrification. So there is a correlation between gyrification index and gyrification itself on the brain. Can autism be diagnosed by brain imaging? It is not available as a biomarker for dementia and autism. Baldarchara et al. Published this after International Psychiatric Congress. But we know that in autistic children there are very significant and obvious abnormalities on the brain, but brain imaging, radiological imaging, does not provide sufficient information for the diagnosis itself. And also repetitive behaviors are very important for the diagnosis of ASD. Basal ganglion morphometrics of these children are measured, and there are very interesting results. Especially basal ganglion volume of the children is less than the others. Right globus pallidus, left and right putamen, right striatum and left globus pallidus, we can see less brain volume than normal children. Cavillary estimator method is the method that we use in our clinic for a master degree thesis. There are certain grids. On this grid, some dots, some markers can be seen. By evaluating the volume 1, 2, 3, the number of the grids are calculated. Intracranial volume is calculated. Again, something similar can be seen. We count them. Tülin hocam, you have lost 3 minutes of your speech time. Coronal T2 flare ventricle volume calculation is measured, is finalized, and square numbers are checked. Sulcus volume, this is a different technique. Hemisphere volume of the brain is measured. I have my teammates, my researcher friends. I would like to thank them for their support. And thank you very much for your patience. Thank you so much.